Do we offer osteoma removal? Well, kind of depends where the osteoma is, kind of. So if you have an osteoma around your knee or around a joint or something, we'd probably defer that to the orthopedic surgeons. The place that we see them is on the forehead, bumps on the forehead, which is a little bony bump for an osteoma. I'm using the royal we, me. I've had a lot of struggles with osteomas. It's always a struggle, and it's always a struggle pretty much uniquely because of the instruments. You need basically a sharp chisel and a little mallet to take it off. Once you have the right instruments, it's easy. We spent a long time trying to get the instruments at the clinic. Struggle with it. Can go to the hospital and do it, but the hospital charge a lot of money if we use their theatres, and so it becomes a little bit sort of cost prohibitive for what the operation is, because the operation is similar in a way to a cyst and what have you, although it's a little bit more involved because you kind of have to sort of chisel this osteoma off. You can do it under a local anaesthetic, so you can stay awake while having it done. So it's doable as long as you've got the instruments. And as I say, every time I've done it, it has been a struggle getting the instruments. And if you know, it's always been a struggle. So it is always a bit like if we have a referral of a patient with an osteoma. Well, we had one the other day and it wasn't an osteoma. The patient thought it was an osteoma, but it wasn't. It wasn't bony hard. So I guess that's the first thing we could examine you to see whether it could just be a cyst or a lipoma. But if it is an osteoma and sort of bony hard and doesn't move at all, then we're into the realms of getting the equipment, and it's a little bit more difficult. And so we take a sharp intake of breath for people who have osteoma.